And now moving on, there are a lot of mysteries in life, and sometimes they can be fun and interesting. But when it comes to our health, not knowing can be terrifying.
Alex chatted with a doctor about what the medical field is doing to clear things up.
Every year, about 800,000 people have a stroke, and a large number of those cases are shrouded in mystery. Here to tell us how the American Heart and Stroke Associations are easing patient anxiety is Dr. Mary Ann Bowman. Good morning, doctor.
Good morning. Good to be with you.
Good to have you. So what is it called when the cause of a stroke is not determined?
This is called a cryptogenic stroke. There are two different types of strokes. There's ischemic strokes and hemorrhagic strokes. An ischemic stroke is when you don't get blood flow to the part of the brain, and a hemorrhagic stroke is when you have bleeding into the brain. A cryptogenic stroke is a ischemic stroke where you have a clot. We just don't know where it came from.
Okay, and who is actually affected by these?
Well, we have lots of people, 200,000 people who have a stroke. Of that 800,000 have a cryptogenic stroke where we don't know where the clot came from. There are some conditions that we know can cause it, and that's why we're trying to raise awareness. Atrial fibrillation. This is where the upper chambers of the heart, instead of squeezing uniformly like that, they fibrillate. They kind of shake, vibrate, and that can cause clots. There's also something called patent foramen ovale, big medical term, but what it basically means is there's a little hole in the heart that doesn't close in adulthood like it should and can cause a clot that can go to the brain. And then there are also people who have clotting issues where they don't clot properly, so they can form that. So these are the types of cases that we're trying to find, so we can reduce that number from 200,000 down lower so we can identify the cause of the clot.
Got it. I like that you're putting it in simple terms. And there's something called the Cryptogenic Stroke Initiative formed. What is that?
This is a really important initiative. The American Stroke Association, together with our sponsor Medtronic, have formed this initiative to raise, number one, awareness of cryptogenic stroke among both patients and among healthcare providers. Also to have consistent evaluation so we can find these cases and find what's causing it. And also we have done a patient guide. This is a support guide that tells patients the information about what a stroke looks like so they can identify it, what questions to ask the doctor, what kind of evaluation for a cryptogenic stroke, and what kind of support services are available in your area. So there's a wonderful wealth of information that will be available to patients.
Great. And so in general, what should patients and, well, people, what should they do to actually prevent anything like this, and if they can?
Well, it's one of the things that's in our support guide, and that is lifestyle changes. So eat better, more fruits and vegetables, lose weight if you need to, quit smoking. That is so important. Know your blood pressure. If you have high blood pressure, take those medications. So many people don't take them. Know your cholesterol. If the doctor wants you on medication, take the medications, and exercise. Get your body moving. Your body wants to do well for you. You just have to give it some help. And it doesn't have to be hard. Just walking is great exercise.
Doctor, that's great. You have all this energy about this. You're like the Bill Nye of heart and brain health. I like it.
That's right. Keep people going. We've got to make progress in this. It is so important because strokes are devastating.
They really are. And Dr. Bowman, where can people go and actually learn more about this?
They can go to the strokeassociation.org/CS for cryptogenic stroke. There's so much information there, and the patient guide is there. We urge everybody to look and use it.
All right. Thank you so much for joining us today.
Thank you for having me.
All right. Stay where you are. The Morning Blend will be right back.